My name is Joana Bernardes. I am originally from Portugal and I'm a postdoc in SYSCID. I've been working in the group of Philip Rosenstiel, which is called Systems Immunology. My main function is as a bioinformatician. So I also contribute into the experimental design and then processing and analysis of single-cell data. And because I use single-cell data, so one of the major points here is that we are really able to have a sense of what's going on in the immune system of the patient and how does it change once you give them a therapy. In my opinion, the major findings and achievements have really been how important it is to take in account time once you do the treatment of patients. So I think one of the key things that we have in this project that it's not that usual is that we have kind of follow-ups on the patient. So we not only take in account how is that the patient is responding to therapy, we also take in account if the patient is feeling better, for example, 6 months after the therapy is given, 1 year, if there has been any complications, and if indeed those complications can be explained by the data that we have previously observed. So I think the contribution of SYSCID in chronic inflammatory diseases is kind of a systematic approach to problems that have been kind of tackled separately. Because we have included a variety of disorders within our goals to achieve, I think it's really interesting to always take in account the specificities of the disease, what we have in common, like overarching, and also how this can relate to the treatment of the patient in the end. So I think we do share, for example, therapies that we have between different diseases, but I think the analytic tools are as important as having shared therapy. So are we looking at the data in the same perspective? Also because we have the different omics layer, we can also then kind of find a integrating path. So that's really interesting about SYSCID. My involvement in SYSCID shaped my career in a sense that I was able to kind of do this project that I never dreamed on, always because the funding is not there, the support is not there, so I really got a chance to kind of do like a dream project, and not only that but also grow as a scientist, because I come from a very different path. So I'm originally an evolutionary biologist, and now I'm doing this more clinical, medical, molecular, and it's so interesting that there's still some things that are parallels, and I was able to really grow and the analysis types that I do and really dive into a very specific subject that I think it's important to do. The major benefits for young scientists to be involved in EU projects is really the group of people that we have within these consortiums. It's kind of like inspiring because one is normally within one group and you have your PI, you have your colleagues. And to also get people from around Europe that come from different countries and kind of also sometimes even different organizations of group, to put all these people to talk with each other and also find kind of like opportunities to share ideas and share perspectives. And it's so refreshing to have you just kind of explain your findings to your colleagues, and there's always feedbacks like, oh, have you tried this? Maybe we can help you with that, or we have this data set that might be of interest. And I think this is very important to be able to have these internal discussions and the input that we give to each other's work. It's crucial to have a successful project. I am part of other EU-funded projects, so I'm part of 3TR, and I'm also kind of a little bit close to Immuniverse. Both of these projects kind of also are the next step in the type of data that we have collected here in SYSCID, and also, for example, 3TR also tries to look at chronic inflammatory diseases as a whole. So I hope that in the future I also take what I've learned from SYSCID and also apply to these projects that are going on at the moment.